Hello, I'm Dr. Brandt Gibson, and I'm so excited to be here. We just talked about the re-education process for helping with peripheral neuropathy. So, reminder, when you got peripheral neuropathy, there are really only 5 ways that you can actually treat peripheral neuropathy. You can repair the nerves, of course, the ideal. You can repress the symptoms, and that's the most typical treatments where you're taking medications or other things that will actually just shut down the nerves and make them so they're not presenting with symptoms. You can reset the nerves where it's like shutting off a computer, turning it back on, basically repolarize the nerves, make them work. You can re-educate the nerves, and you can release the nerves. Today, again, we're going to talk about the first machine that I found several years ago to treat peripheral neuropathy through the re-education process. So this machine is unique. It actually is designed to take you through a sequence of electrical stimulation. It takes you through that sequence, and what it does is it actually starts to educate or help the nerve to communicate more correctly with the brain. The company commonly describes it as it's actually sending non-pain signals, but what it really is doing is actually helping that nerve function like it's supposed to, so that when it communicates with the brain, instead of the brain misinterpreting the information as pain, it actually sends it back as a real sensation. So this works really, really well. It's working in 85% of the individuals through the studies. We're seeing a little bit higher rate of that if you go into this very carefully and you know what types of peripheral neuropathy you're treating. But the point is, you take electrical pads and you put them on the foot and the ankle with the idea of creating a electrical current that can be run through the nerves through a sequence, through a scrambler type therapy where it's sending multiple different signals and it's getting that nerve to start to communicate the way it's supposed to. And then between the brain and the nerve, they're re-educated to communicate correctly with each other, and it solves the problem. How does this work? Typically, you'll try it one time because it works. It's so effective in most individuals that you can try it a single time and you'll notice a difference. So we usually get you try it one time, and as you try it, you say, okay, yeah, this is working for me. It's something I should utilize. And so the one treatment, however, the improvement will only last for 30 minutes to 2 hours, because it takes time to re-educate that nerve. And so what you're doing is you go, a single treatment only lasts about 2 hours. You do a second treatment, it's going to usually double that to 4 hours. Third treatment, longer. And the idea is over a series of 10 treatments in most individuals, it is completely re-educate the nerve in such a way that it's functioning correctly. Now, depending on how much nerve damage you're doing on a daily basis, then this can actually last for a period of time. It can last for months. In their studies, they actually showed a lady at a year that was still having no symptoms. The whole point is we're trying to manage the symptoms. We're trying to help you function for a period of time through re-educating the nerve to cause a malfunctioning nerve to communicate correctly with the brain, and your symptoms go away. This is valuable. This is a treatment that should be tried. Again, this was the first machine that I found that actually really does this process. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 385. And I'm excited to be able to start sharing that with you. I also want to introduce you to Peripheral Neuropathy Unmasked, a new book that's going to be coming out. It's not out yet. You're not able to order it yet, but if you'll stick around and you'll pay attention to the videos, we should be able to give you a way that you can sign up so you can start getting advanced information about the book and be able to get it. You can also look on Amazon. You can look on Barnes & Noble. The book should be coming out, should be available soon if it's not there already. But the point is, if you would like, you can actually hold on to it, and I will actually create a process so that you can get your hand on the book for just the price of shipping. This is Dr. Brandt Gibson, and thanks for being here. Remember, Calmare is a valuable treatment for re-educating your nerve to help it so it functions like it's supposed to. It's Dr. Brandt Gibson. Have a great day. We'll talk to you later.